Welcome to the Grow Your Practice podcast. Hi, I'm your host, Chad Madden, owner of Madden Physical Therapy and Breakthrough. Join me each week as we dive into the best practices, systems, principles, tips, and tricks to help you grow your private practice. In this episode, we're going to talk about the benefits, and many of them are hidden, but the benefits of doing a reactivation. So what are we talking about with reactivations? This is a patient that you've seen before in your private practice. You treated Mary 2 years ago for her total knee. Now she's coming back in for her shoulder pain. Right? So that's a reactivation. And whether you have a physical therapy practice, chiropractic clinic, dentist office, podiatrist, etc., we all rely on reactivation somewhat to drive our business. In the last episode, we talked about the 10 challenges that happen with reactivations that we're hearing from private practice owners. Many of those I've struggled with myself. In this episode, we're going to talk about the benefits and why, if you are doing very little with reactivations, you should rethink your strategy and put some effort in here, especially if you have the capacity to treat more, or you want to improve your payer mix, or you want to increase your lifetime patient value, and you're positioning for growth. So you're trying to gather market share. One of the easiest things to do, and I would say it's the easiest channel to work with, is reactivations. And the 5 new patient channels, very quick review: reactivations, number 1. Number 2 is friends and family or word of mouth referrals. 3 is other professional referrals, so physicians, nurse practitioners, PAs, podiatrists, dentists, etc. 4 is partners, large organizations in your area that employ, or social civic organizations that promote you to their lists. And 5 is cold traffic marketing. In this one, we're talking about specifically reactivations, which is it's the lowest hanging fruit of any new patient channel, should be the least expensive. This person is already on your list. They already know, like, and trust you. So we're going to talk through a list of benefits here in this episode, and I'm going to give you 12. So the first one is increased revenue stability. And for many of us, we have a slow season. So years ago, 2007, I think I lost, if I remember the numbers right, roughly $44,000. And in 2009, I lost nearly $100,000, and that was in Q4. And by nearly $100,000, I mean, like, I think it was $98,870 or something like that. So pretty close to losing $100,000 in 3 months. It was devastating, devastating for the practice. And fast forward a few years later, by 2011, we kept thinking, and I remember sitting with the marketing team. I was like, the fourth quarter every year, we are just getting hosed. It is costing us money to stay open. This would almost make financial sense for us to close. That's one option. Or the other option is we can double down on our marketing and make this our busiest time of year. What would that look like? And, I remember I hit some resistance within our team, and they were saying things like, well, nobody wants to come in during the holidays between Thanksgiving and the end of the year. They're busy, stuff like that. And I was like, I think we're looking at it the wrong way. At the time, we didn't have 5 new patient channels in our thinking. We only had 3, and they were patients, physicians, and cold traffic. That's all I really considered our 3 channels to be. Later, we added in referrals from patients and referrals from partners. But nonetheless, at that time, that's what we were thinking. We're like, okay, so let's think about cold traffic marketing. Can we double down there? Well, the simple answer here in Northeast US is no, because that's when Target and Hobby Lobby and Walmart and Michael's and every other retailer is doubling down on their advertising, because that's their most profitable time of the year. And they know there's a buying season, in particular around Christmas and the holidays. So they're going to advertise even more. It's very difficult for us to compete there. And if you're familiar with blue ocean strategy, that is not a blue ocean. It's a red ocean, right? Very bloody, very competitive. So we said, okay, we can't go there to mitigate this. It's going to be wasted effort, or we're going to have to work really, really hard there to make this our busiest time of the year. Okay, let's go to physicians and other professional referrals. Well, that's the time that they're most flooded. With, in particular, I joke around and call it white powder, but by that I mean flour and sugar, right? So you have the pharmaceutical companies, the equipment companies, any other vendor that is servicing that physician. That's when they take that 4 pound chocolate bar into their office, right, around the holiday season. So that's very difficult to compete there. So we took and we said, okay, so those two channels are gone, and we're left with our patient list. And what can we do here? So that was the year. If you're familiar with Greatest Promotion Ever, I've shared this repeatedly. It's in the book, um, Killer Marketing Secrets, that we published back in 2015, and shared that with the private practice industry. But in 2011, I wrote this. So use the template from Yannick Silver, and I wrote basically a day of free exams. I believe we ran that on November 4th. It was definitely the first week in November of 2011. And what happened is we ended up with 70 plus reactivations on this single day for a single site clinic. And the waiting list that we generated from that event carried us through an additional 7 weeks. So not only did we have to work through all these reactivations, we also still had it was a decreased flow, but we still had physician referrals coming in. We still had people coming in from cold traffic. And at that time, we were only offline, print ads, direct mail, etc. So what that really did for us is it gave us significantly more increased revenue stability because of all the reactivations coming in. And in fact, that Q4 of 2011 was it was the highest revenue we ever had. So it was a new record for us. We had highest months ever. We had most new patients ever. We had most profitable ever. And it was all from going through and putting together an offer for our past patient list around reactivations. Number two is higher lifetime patient value. So think about this. If you are advertising on Facebook, on Instagram, on TikTok, on a Google ad, you're paying for your website, you are uh, doing print, you're doing direct mail, you're doing any other sort of radio, TV, etc. You're paying for a new patient, or if you're still doing boots on the ground, going to physicians' offices for referrals, all of that is fine. But realize there is a cost to that. And when we have that new patient come through, we can get to the end of their plan of care and say, okay, now you're out of pain. Now your objective measures are normal. Now you're back to full function. Hope I never have to see you again. Right. Huge mistake. I haven't heard that in a while, but I can remember in the late 90s, early 2000s hearing other clinicians say that. That is a wild thought. But really, from a business perspective, from a better business math perspective, we want a higher lifetime patient value. And that means that if Mary came in for 12 visits for a total knee, and let's say, just for simple math, that was $1,200, that, if she comes in and let's say our cost to acquire that was $100, if Mary comes back in 2 years later for her shoulder pain now, like in our example, and we see her for another 12 visits, and that's another $1,200. Well, now our cost to acquire a patient went from $100 down to 50, right? So it greatly reduced our cost to acquire because now we can spread that out over two plans of care for Mary, and in the end, we take our Mary's lifetime patient value from 1,200 to 2,400. This doesn't seem like a big deal, but very small changes. And I know John Logar presented at our breakthrough events. I think he's done this 18 times now, something like that. I've seen this over and over and over again. And John would talk about this J. Abraham principle that if you just added, a 10% increase in lifetime patient value, or just 10% of your patients came back in for additional care, what that would do to your bottom line. And it in the end, it ends up being like it grows your business by 33%. So it's a very small lever, which means a very big deal to your bottom line, the value of your business, etc. I know one of the things that we look for, and this just came up, where we are looking to acquire another practice. I wanted to know how well they were doing with reactivations. Why would I want to know that? Well, I want to know it because it gives me a really good insight into how they're treating their patients, right? If they have a lot of reactivations, if 50%, and this practice has been around for decades, if 50% of their new business is coming from reactivations, I know that they have a high graduation rate. I know their list is warm and those people are willing to come back in. Now, if I saw that, let's again, I'll keep this hypothetical to protect the NDA, but let's say they've been in practice for 20 years and that reactivation number is 10%. Now I know that it's going to be a lot more expensive for us to buy market share to fill up the space, fill up the schedules for that office. So think about that from both the buyer's perspective and your own perspective, but higher lifetime patient value is a really big deal. Um, and again, it's those needs are out there within your patient list. You just need to be able to work that. Number three is more efficient operations. When we have a reactivation come back in, they likely already know your patient care coordinators. They likely already know, like, and trust your clinical team and your clinicians and your techs and your aides and your assistants and everybody else. So that's creates some organizational efficiency. When a returning patient comes back in, oftentimes they're just maybe re-signing a statement or two. You don't have to do all the intake paperwork over again. That the baseline assessment, especially if it's for the same problem that's now exacerbated years later, that you have some historical perspective there. Their past medical history. You're doing a lot of updates, and that saves you a lot of time, money, and resources as an organization. So that's something else to think about as well. It's more efficient. The other thing that I'll say around efficiency is, and I talked about this in the last episode, with reactivations, your cost to reactivate should be significantly lower. And I mean like 10 to 25% of the cost of doing things at the other end. So physician referrals, partner partner promotions or workshops, health fairs, etc., or cold traffic marketing. Your reactivation should be a fraction of that. And for any new office that we have, when we open it up, our marketing budget is 10% of the expected revenue. So if we expect in month one, two, three, that the capacity is about $40,000 a month in revenue, we'll spend up to $4,000 a month in marketing. But again, that's because we have to go to cold traffic because we don't have that patient list yet. Over the years, as that clinic continues to grow, we should get more and more efficient. So we can go from 10% of our gross rev dedicated to marketing and market share down to 9.5%, down to 9%, down to 8.5%. You get the idea. The lowest that will go is about 7%. And that's just for our practice. Maybe your practice is different. The lowest I've ever seen for a growing practice, where they had a really nice reactivation system in, is 6%. It might have been 5.5, but you're not going to go much. You can't make it zero, but you can make it closer to zero, more efficient, as you grow your patient list and as you get better at reactivations. It's worth solving and figuring out. Enhanced clinical outcomes. So people who come back in who are reactivated, much more likely to stick to their plan of care, much more likely to achieve their long-term goals, and much more likely to become, you're really only strengthening their raving fanness, for lack of a better, their ability to, if Mary did great with her total knee 2 years ago, and now she's back in for her shoulder, and we take care of her again. Now it's justified even more, for now she's definitely coming back in the future to us again. She's much more likely to refer to her social network, much more likely to get a review. All those other things are there. And in the end, she's going to have better clinical outcomes, all things being equal, comparing her to a physician referral, cold traffic, etc. Number five, stronger community reputation. If I'm building a practice, so I'll use our dolphin practice. There are 3,000 people living in that area, roughly 1,700 mailboxes. We own 1,100 of those mailboxes, right? So entire town has 1,700 mailboxes. 1,100 people are already on our list, and that has happened in 6 or 7 years. And yes, in the beginning we had to do cold traffic marketing. We were new to the area, but yeah, reactivations are a big part of our game now. But now many of the people on our list out of those 1,100 have they're repeat patients, right? So they've come in for additional things, much of that list is reactivated. And those consistent patient relationships really generate a lot of practice loyalty for us, and generate more word of mouth referrals. It's like the only thing in town. Years ago, they might consider driving to an adjacent town, in Linglestown or Halifax or something like that. That is no longer the case, right? Really good reputation, um, for our practice within that town of Dolphin. And again, we pretty much own every mailbox in that area, or at least roughly 2/3 of them. Number six, improve staff satisfaction. I talked about organizational efficiency, but also consider how much easier it is for your staff, where they don't have to forge a new relationship with a patient. And there's a bell curve there for you, regardless of how many clinicians you have. Some of your clinicians can do it really well. Some of them struggle, right? But in general, if I'm working with a patient that I already know, like, and trust, um, I, I, I'm going to be happy. I don't know how else to say that. Where, and the example that I'll give is the other day, and our group used to joke around with me about this, but they would be like, why are you here in the clinic? And I would say, and the first time this happened, I said, what are you talking about? They said, we want you to go out and, like, go to Costco. Now, why would my group tell me to go to Costco? So when I go out, and this is just my own mentality, you get a little glimpse into the OCD insanity that I get to live with. But the I, I just see, like, nothing but need everywhere that I go. So if I'm at Target or Costco or Panera, or and I'm just Starbucks, wherever it is, it's really St. Thomas, coffee roasters, wherever I'm at in my community. I just see people that are moving non-optimally, right? And I I can remember years ago, I was in like a family therapy session, and uh, the therapist was walking across the room, and I said, "Hey, what's wrong with your hip?" And she kind of froze, and she was like, "How did you know something's wrong with my hip?" And I was like, "I do movement analysis for a living, and I can just tell you're in pain." And she ended up becoming, like, a raving fan for our practice, but it was just on noticing that. And I can't turn that off. So everywhere I go, I see, Trendelenburg gaits and all sorts of lower kinematic chain deficits. And if somebody has, like, a torn rotator cuff and they're not moving well and they have poor scapulohumeral rhythm, I'm going to see that right away, and I can't not see that. So I was in Costco the other day, just last week, and in the very beginning, as soon as I walked in, saw a husband and wife. I've known them for years. Have treated I'm going to guess I've treated the wife 7 different times, um, and I know her family. They have a little bit of a blended family. They must be in their 80s right now, and I noticed a movement change with the husband and commented on that. While I was doing that, I saw somebody else walk by, where I treated him and his wife for over the last 20 years, right? And I've seen them both multiple times as well, and we talked about fly fishing and everything else. So, I mean, what ends up happening, like, both of those couples, I really like, right? I know everything about them. I know, I knew that they had just traveled, right? That they had been to Greece. The other gentleman, I knew that, that fly fishing season was in, and I know exactly the trout club that he belongs to, and that he was active in that. So it's like, all those stories come bubbling back, and that being part of the community, being part of those strong social ties, makes me really happy. So realize that that holds true also for your clinicians, right? Bringing people back in, especially if they're social. Again, there's going to be a bell curve there of competency there, but for the most part, it's easier on your staff. It will make them happier, make them more content, make them more satisfied when they're seeing people through reactivations that they already know. The other thing, it gives you a little bit of a moral boost, right? So, like, if I saw Mary and she still remembers me, and now she's coming back to me again, I'm like, okay, like, this validates me with my own internal conversation as a clinician, right? That I did well. the opposite of that is think about what happens when you hear that, you saw Mary 2 years ago and now she's going to the clinic down the street for whatever reason, right? Even if her doctor sent her there, that still is slightly upsetting. So, this is the inverse of that, and you're going to get improved staff satisfaction for your clinician. So, seven, more predictable scheduling. What we can do there, whether it's the seasonal slowdown or the slow season that I mentioned before, or anything. Typically, you don't have to go through the whole rigmarole again of getting people in and getting them scheduled when when somebody's reactivated and they come through versus a new patient. You might have to go through all of your scheduling, and it's just going to be harder to do. The other thing that you can do, this is way more advanced, but it's something for you to think about. Let's say you're really busy in the evenings, 3 to 7, and early mornings, 7 to 9, but you have this block of time in the middle of the day from 9 to 3. Now you have a patient list. What could you possibly do in marketing to your past patient list so that you're full from 9 to 3, or just as busy from 9 to 3 that you are from early morning and in the evening? My guess is you can segment your list, right? So you can think, should I be doing promotions for reactivation for the high school athlete or the person who works from 7 to 5, right? Probably not. What if you want to fill 9 to 3? Then you're going to go to um, your stay-at-home moms, your retirees. You get the idea there. So you can segment your list or change your marketing offer to your patient list so that you're smoothing out your schedule. That's a little more advanced, but it's very possible to do. We think about that here within our practice, and I know a few other practices that do the same thing. Number 8, reduce marketing costs. Talked about this, but the industry standard is reactivating a past patient is 5 times less expensive than acquiring new ones. I think it could even be higher, especially if you're effective with your reactivation system. Number 9 is better treatment compliance. Returning patients, again, they're going to likely to stick to all their exercises with their home program or whatever the home program looks like. Just much more likely to follow through with your treatment approach just by them coming back in to see you again. By being a reactivation, we can assume that they respect you, right? That they have a respect for your expertise. That's why they're coming back in. If not, they would go elsewhere. Number 10, greater practice evaluation. So I talked about this briefly, but practices that have a history of strong reactivation rates, they demonstrate basically better revenue certainty. If I'm buying a practice and that practice in our hypothetical example has been around for 20 years, 2 decades, and they don't know how to reactivate, that tells me that their list isn't warm, that they might have a lower graduation rate, and that I have a lower uncertainty for future revenue, right? When somebody's buying a business, that's what they're buying, certainty of future revenue. Now, in our practice, we average 200 plus reactivations a month, 2,400 a year for our 6 locations. That, if I were out in the market and I were selling my practice today, that demonstrates that, we have systems in place, processes that work, and a significant portion of our revenue is highly reliable, roughly $4 to $5 million a year, highly reliable revenue at a fairly low cost. So you can think about that. If somebody is like, if I were looking at a practice that, let's say, they did $1 million a year in revenue, $200,000 in EBITDA, so 20% profit margin. I know there's lots of intangibles in there, but and they've been around for 2 decades and they have 10% reactivation. I would be thinking a lower multiple, right? So practice value is earnings, in this case 200K, times a multiple. That could demand somewhere between a 3 and a 5. But I would go towards the lower end if I were valuing the practice, because that future new patient flow is less stable because that practice doesn't know how to do reactivations, or their list isn't warm, or they've never sent an email, or they send inconsistent emails, or they've never done a text campaign, or they've never done direct mail, or they don't schedule rechecks or anything like that, right? So they have no reactivation systems in place. That is a lower valuation. The other thing that I'll say on this that has nothing to do with reactivations is there's a common misunderstanding if you are thinking about practice valuation and that's on your radar, that somebody else coming in, and this has happened to me too many times for me to ignore it. But what will happen is occasionally I'll be talking with a practice owner about a merger and acquisition, and they'll say, "Yeah, but you'll come in here and you'll put those systems in place." And I was like, "Yeah, but like you don't buy and sell a practice based on the potential revenue." Right? You don't get arbitrage, you don't get a plus, you don't get so like if I'm selling my practice and I have no reactivation systems in place and they're poor, but my future acquirer does um, have an advantage there and they know how to do it. I don't get the benefit. I don't realize the financial benefit and the financial value of my practice increase in selling my practice to them. So that's a common misunderstanding, and yeah, we probably should just do a whole episode on that because that has reared its head in a few fairly difficult conversation ways over the years. But yeah, that if you are thinking about selling your practice, get a reactivation system in place. You need to be able to demonstrate that that you're not relying on a single physician, or that you're not relying on, a large insurance contract or something like that to drive your new patient channels. You want to show diversity. You want to show certainty of future income. Number 11, data-driven decision making. So we're a scientist in the clinic, right? Every single person that is listening to this right now, if you're a clinician and I asked who has the highest quality of care in your area, you're going to say it's you, right? Every clinician, even if every single clinician in the country, in the world, listen to this right now, we all have this belief that we have the highest quality of care, and then we'll justify what we really do, right? So I would say the only way for you to do that is by being scientific. I'm not talking about evidence-based practice, although I think that should be part of it. But you're a scientist in the clinic, and if you think that dry needling has grade A research behind it, and you're seeing excellent results with dry needling, then that's your reality. Fantastic. But you're a scientist with that, right? So you're either using anecdotal evidence or you're using research-based evidence to justify what you're doing with patients when they come through to provide them the highest quality of care possible and the most likely probability of high and positive outcomes. So we can agree that you're within the clinic, and as a clinician, you're a scientist. Why would you not do the same thing with your marketing, right? So we know that, let's say we send out our patient newsletter in PDF format via email, and the subject line is Madden and Gilbert PT newsletter, volume 23, issue 4, right? And that's our subject line, and it doesn't work, right? With uh, no trackable reactivations from that, regardless of the content of the newsletter. And we see very low open rates and we see high unsubscribe rates, and um, you know nothing really trackable from this. Well, that's not being scientific, right? That would be like just dry needling blindly every single patient and never looking at the outcomes, right? So we'd never do that, or never think about doing that as a clinician within the clinic with our patients and our patient care model. Why would we possibly do that with our marketing, right? So you want to use data to do more of what works and less of what doesn't. And yeah, so data driven decision making, we want trackability as much as possible. The only way to do that I know of is through direct response marketing. That's, if you listen to the podcast, that's all I've ever talked about in the last 12, 13 years here at Breakthrough, is direct response marketing, always requires a call to action, always is trackable. So therefore, we can do more of what's working, less of what doesn't. Number 12, competitive differentiation. So why would I adapt, reactivation? So in my area, I get to compete with Select Medical and now Dreyer or Upstream. We have 3 hospital systems in place. Very competitive market here in central Pennsylvania. What's the one thing that my competitors can't touch is our patient list, right? They can compete with me on Facebook. They can run nearly the same identical message in our Facebook or Instagram ads. They can have their therapists create organic content the same that we are. They can compete with us in Google. They can compete with us in print. They can compete with us in the mailbox. They can compete with us on the radio. They can compete with us on television. They can anywhere that we're buying media, they can buy media except for one place. And that's in our patient list, their mailbox, so snail mailbox, their email inbox, and then also their text, right? Their text inbox. They can't compete there. And we can be very, very different. I mean, if I had to eliminate everything and just rely for, infinity on our patient list, we could do that. I wouldn't be happy about it that I couldn't go out, and add more names to our list over time. But if we had to eliminate, word of mouth referrals for some odd reason, if we had to relate or eliminate physician referrals forever and ever and ever, we had to eliminate partner referrals and that had to go to zero, and we had to eliminate cold traffic marketing, could we survive on reactivations? We could, because that is the one place we're dramatically and easily differentiated from every other competitor, because they just frequently they don't have that contact information. So that's, again, getting back to that blue ocean strategy. And just as an aside, blue ocean strategy is where you look for non-competitive places to operate in terms of your business. Red ocean is the opposite of that, which is where there's a lot of sharks in the area and the water is bloodied. So there's a book about it. I believe the book's called Blue Ocean Strategy, but we're constantly looking for that as a practice. And the easiest place to compete is where there is no competition in that blue ocean, which is where reactivations live as well. So easy for us to stand out in the market, and not nearly as crowded as some of the other places. So we went through the 12 benefits of reactivation. Hopefully, if you've listened to both of the last 2 episodes where I talked through the 10 challenges and now the 12 benefits, and just to review those really quick or recap those really quick, it's increased revenue stability, higher lifetime patient value, more efficient operations, enhanced clinical outcomes, stronger community reputation, improved staff satisfaction, more predictable scheduling, reduced marketing costs, better treatment compliance, greater practice valuation, data-driven decision-making, and competitive differentiation of your practice versus your competitors in your area. And I still haven't convinced you to do reactivations. In the next episode, I'll walk you through a story specific to my own struggles and understanding and it'll help you understand how much reactivations have evolved over time. I'll also try to go through for you the 4 levels of reactivations. Let's call it competency or skill level that I see amongst practice owners. You can see where you're at amongst those 4 levels, and I'll give you an action plan of how to take the next step up to the next level for you in your private practice. Hope you very much enjoyed this episode, and I'll see you in the next one.